the introduction. And thank you very much for the committee for selecting our abstract for presentation. These are our disclosures. So Lenacapavir, or Len for short, as you all know, is a potent first-in-class long-acting HIV-1 inhibitor with picomolar activity, which is active against HIV with resistance to the other ARV classes. It's been approved for the treatment of heavily treatment-experienced patients, people with HIV, with multi-drug resistance HIV-1 in combination with an OBR. I'm going to use some of those acronyms through the talk, like such as OBR and resistance analysis resistance-associated mutations, or RAM. So we have shown already the resistance analysis mutation at week 104 that were reported earlier. And the capsid mutations were the one that most people are familiar with that are listed here. The objective here is to stereo. Okay. Is to describe the viral response in the study Capella through week 156 of study. So this is a reminder of the study design for Capella. The patients who were enrolled were in situation of treatment failure, and they had resistance to at least 2 agents from for 3 or more of the 4 main classes of drugs, and that was assessed by screening tests as well as historical reports in some cases. The study included a 14-day Len functional monotherapy period, which was followed by a maintenance period that lasted up to 156 weeks for now, where participants received Lenacapavir subcutaneously every 6 months. And there were 72 participants in the study. This slide shows the baseline resistance, focusing on the main ARV classes. So you see on the left, the classes are listed, and the number of participants are shown on the right. So you can see that there was a very high burden of resistance at baseline, with all but 1 participants having 3 or 4 class resistance. And this is also illustrated in this Venn diagram that shows the 4 main classes and the number of people who were resistant to them. So with all the number clustering in the middle indicating the high level of resistance. And so nearly half had resistance to the 4 main ARV classes. And despite this high level of resistance, as shown here, over 80% of participants were showing treatment success through the study in this missing equal excluded analysis. So good response, and also in terms of CD4, there was a really meaningful increase of 164 cells per microliters at week 156. So a little bit of the method. So I've already mentioned the baseline analysis. We've also done overall susceptibility scores that included genotypic and phenotypic data. And I'll talk about the scores. Oops, how do I go back with this? We also conducted resistance analysis at virologic failure, and we did measure OBR drug concentration in plasma to have a feel for the adherence of these patients. So talking about the resistance analysis, then out of the 72 participants in the study, we had 28 who were included in the resistance analysis population. And so out of these, were further divided into 2 groups of 14, one group with no Len RAMs and the other group with Len RAMs. And so for those Len RAMs, as I mentioned earlier, they were the same as previously reported. They're shown on the right We had no new participants with Len-RAMs at week 156 compared to week 104, with only 2 participants for whom some additional mutations showed up. The resistance, as indicated in this graph, was really noted mostly early on in the study. So I'm going to first describe the participant in the resistance analysis who did not have Len-RAM emerging. And so what I'm showing here is the OBR at baseline and the activity that it had. So as you can see on those 2 left columns, the OBR is listed and the OBR, the OSS of the overall OSS of the OBR is listed as well. As you can see, as indicated in the bullet, the median OSS of OBR was 2. So 2 active drugs on which Lenacapavir was added. So the table is a little complex, but it shows all the 4 main classes as well as the entry inhibitors. And the color coding is red being drugs that are inactive, orange is partially active, and green is full activity. This busy slide, which I'm not going to describe in detail, shows the response in that group, again, of participants with no Len-RAM emergence. So those 9 participants who eventually achieve viral suppression after the resistance analysis, and again, without any resistance mutations. And this is the other 5 within this group who actually remain viremic throughout the study. And as you can see, for these participants, we analyzed them, at many visits because they were viremic, and we still, didn't see resistance in these participants. So that's for the first 14. The second 14 are what I'm going to talk about now. And so again, similar table as before, showing the extent of the resistance at baseline and the limited options that these participants had. And again, here in this group, the median OSS was 2. So this table shows the analysis, the resistance analysis, showing a column with the HIV subtype, the visit that was analyzed, the Len-RAMs that were detected, the fold change, and then the replication capacity in PBMCs, which is expressed as a % of the wild type. Then the next column is the reason why Len was the only agent at the time of the resistance development. And then we have the last column shows what happened post-virologic failure outcome. And so as you can see in the column in blue, in all cases, Lenacapavir was the only agent at the time of resistance, so functional Len monotherapy, and which was due either because the OBR was totally inactive, or the participants were non-adherent to their OBR. So a lot of Len functional monotherapy. So 5 participants who had OBR change, and it's indicated in the last column in green. Either they had OBR change or improved adherence. They were able to resuppress the HIV RNA, while the other 9 participants who did not have any improvement of their OBR adherence or any changes in their OBR remained viremic. So in the interest of time, I'm going to describe 2 examples of participants with resistance, one who were suppressed and one who remained viremic through the study. I mean, after the resistance analysis. So this is participant 2, the viral response and the resistance is indicated. So again, you can see on top, the OBR is wrong button. Anyway, the OBR is indicated on top in the gray box, and you can see on the left the key to the color coding. So red, again, similar to the table I mentioned, so red, orange, or black. I didn't use green here. So as you can see, these participants was receiving doravirine, fostemsavir, and ibalizumab, and they were all inactive at the time of resistance development with the M66I in this case. When when active agents were added at week 24, that included lopinavir as well as bictegravir, the participant resuppressed, and so that was a positive outcome for here. When we overlay the drug levels for these participants, we can see that the participant was mostly adherent to the new regimen, and you can see here in blue, it's the drugs that were part of the regimen. We didn't measure all drugs, but several of them. So FTC and tenofovir, and you can see that the drug level curve really is mirroring the virologic response curve. And so then the second participant, again, with the same color coding, we can see that this participant also had no fully active agents. Maybe TAF was partially active. But when that participant added fostemsavir around week 100, there was really no benefit to the participant. And adding overlaying the drug level on this graph is showing that the participant was mostly adherent to their OBR, but it was just not active. Interestingly here, if you look at the curve in red, which shows the darunavir level, it appears that the participant stopped taking darunavir around week 65 or so. So we also did some replication capacity analysis, and this is in... Yeah, okay. So replication capacity is showing here that there was a severe reduction. That's the last slide. And the most of the LEN-RAMs were associated with replication capacity issues, which range from 0.1% to 98% of wild type. And the median was around 27% of wild type. So in conclusion, I've described that the capillary participants were heavily treatment experienced with limited treatment option, and that was by design in the study. At week 156, the suppression was maintained in 80% of participants, and the treatment emergence RAM was seen in 14 of the 72 participants. And again, the RAM emergence was due to LEN functional monotherapy, either because of OBR non-adherence or having an OBR with no fully active agents. And so 5 participants were able to resuppress, even though they had LEN RAMs, receiving RAM upon OBR change or improved adherence. And most LEN RAMs were associated with marked reduction in replication capacity. So I would like to acknowledge the study participants and the investigator staff, and I thank you for your attention and can reply any questions.